Hey everybody, it is April 14th, 2020. This is Tonya Shepherd Hatfield, family nurse practitioner. We are going to talk about today's virus. Um, okay, here's the big talk. Today in Floyd County, we had our first confirmed cases. Now we knew this was coming. The reason we hadn't seen these before, now we didn't have the testing abilities here to be able to come up with some numbers. But earlier they said there was one case. Then actually, when they got on live, Thursa and Robbie Williams got on there a few minutes ago at the Mountain Arts Center. There's actually three. I don't know details about these people. If you know details, you don't need to be talking about them. We got a 64-year-old female. We've got a 22-year-old male and a 21-month-old baby. So there's our three confirmed positive cases. They said that none of these cases are related that they know of at this time. So that means that these people could have picked this up at three different places. Most likely that's what's happened, because if you think about it, everything we've got right now is closed down. So the only places that you can shop are like the dollar stores, the grocery stores, and Walmart. So, and it's been that way for several days now. So most likely, if these people got it, it's because somebody was in one of those places. So, every one of us and everybody that is out there right now watching this, in Floyd County, you've been around it somewhere. Everybody's like, oh, it wasn't in Floyd County, but it was Austin County and Pike County and Lawrence County and Prairie County and Knott County, all these counties around us. Well, I live in Floyd County, but I travel to Pike County and to Perry County to work, just like a lot of people around here do. We are traveling. This is a region thing. This should not be confined to county lines, but for logistics purposes and for data collections, and for our health departments, they have to know what county these are coming out of. But as a region, this has been here, and people that are acting all freaked out now because, oh, we have positive confirmed in Floyd County, just stop. It's been here. We're just now getting enough tests to where we can do the we can check. And the whole KFC thing, I don't know that that's true. So that could be just gossip, and it really don't matter. It don't matter where any of these people worked. It don't matter any of that. None of that matters. And it gets on my nerves, these people that freaks out thinking that it does matter, because it don't. It don't matter who these people are that's coming up positive. It don't matter where they work. It doesn't. None of that stuff matters. If you need to know, then the health department's going to contact you and let you know that you need to know. But you need to act like everybody has it, just like I've been saying for 3 or 4 weeks now. Act like you have it and don't want to give it away. Act like everybody else has it and you don't want it. So, and that's the only way. If everybody acts like that, then you're less likely to pick this virus up. Don't touch your face, wash your hands, social distance. Now everybody's suggesting you wear a mask when you're out, and it's not necessarily to protect you from everybody else, but it's to protect everybody else from you. You have to do your social distancing. Stay away from people. Quit congregating. Don't get in a car with people that you don't know. Most of the stores are limiting the people that can be in there. You got one person per cart in the stores. Shop for your neighbors. Wear your mask. Do your social distancing. Wash your hands. Use hand sanitizer. Lose the gloves. Y'all are just contaminating everything with your gloves. Don't hang around or socialize with people that don't live in the house with you. No social gatherings, no mass gatherings. Take your shoes off at the door. Cover your coughs. That's probably been my most conscious thing whenever I'm out in the store, is like, I have horrible allergies, and it's like all these trees have been blooming, and so they've been crazy. I'm afraid to cough. I'm like really self-conscious about it. I don't want to cough in public. I will hide my cough to no end and let my eyeballs pop out of my head before I will let out a big loud cough. Um, anyway, they're talking about when they have these positive cases up now, they will do this for as long as they can. If they know that they have a positive case, and they're going to interview these people and find out who they've been around, what they've been doing, and then they will contact people that have been around them if you have any business of knowing this. So if you could have possibly been exposed, the health department's going to try to get up with you. So 3 positives in Floyd County today. Tomorrow there'll probably be more. I don't know when they exactly started doing these, this increase in these swabs, probably this week. So that's going to be a fairly decent turnaround time now. Apparently ARH is leading up Floyd County in this, so that's good. That's a big hub for us. So these are every day we're going to probably have more and more just because they're doing the testing. And that's great that we've got the testing. We got to get these numbers. We got to get these statistics, but we can't have people freaking out and witch hunting the people that turn out to be positive. There is 1.9 million positive cases in the world, and there's been over 125,000 deaths up to now. The U.S. has 594,000 positive cases, and we've had 25,000 deaths in the U.S. We've also had 471,000 people recover from this. So a lot of us are going to get this. We're going to get sick. We're going to be laid up for a week or so, and then we're going to get okay. And that's great. That's what we want. But we're still going to get this, and they're still going to get those people in our community. They're going to catch this, and they're not going to be okay. I mean, the one guy today, 22, he was 22 years old, 22-year-old guy got this. So don't think that you can't get it, because you can. And, you know, somebody in your household is probably going to end up with this. Kentucky also lost their first healthcare worker today. Now, for those of you that don't work in healthcare, it may not hit you as hard as that hits me, but healthcare people are the ones that's fighting this out there, all across the board. This is put your nurses, your respiratory therapists, your doctors, your housekeepers. The housekeepers have to clean this stuff up. I mean, these hospital workers, clinic workers, just all of us in healthcare, this is not an easy thing. We get up and go to work every day knowing that this is out there, and we go anyway. You know, and there's people out there that are worried about where these people work. Well, you know, they come to us. They come to us sick. If they're sick, they come to us. And we're standing right there ready to help them. So the least that people that don't have to be out, then don't. Don't risk yourself. Don't risk your family. Okay, they said none of the cases today were related, and they were all tested through different labs. We had 177 new cases today in Kentucky. I don't think the governor mentioned Floyd County today, though, so that information may not have got to him yet at that point. Let's see. We got any questions over here? Tammy, I don't have my office up and running yet. We're getting close, though. Oh, yeah, do not wear your gloves while eating. That is disgusting. Okay. Any questions while we're doing this, just throw them out over here and we'll address it. Because this is, you know, and I know it's really scary for a lot of people that don't understand this and don't understand exactly epidemiology. All you're hearing is there's this horrible virus out there and it's killing people. And Now it's in our community. No, it's been in our community for a while. We're just now putting putting the numbers with it that we need to be able to figure out how to contain it and how to control it. And they're working on vaccines. They're trying to figure out medicines that's going to take it out. And right now, the best thing that we can do is try not to spread it. Yeah, but we got a 21-month-old baby with this, and it'll probably be fine. But we need to pray for those that we've got out there that are sick, and we need to pray for our community, just period. Pray for our world. And those of you that don't agree with me about praying, then just don't agree with me and just be quiet and sit over in the corner and social distance. Because I'm going to pray about it. Now, let's see. All right. I don't see anything over there right now. I'm going to go through our links here. So we've still got time. If you have any questions about anything, throw them out there because I'm going to throw up some of these links. I talk to a lot of people in healthcare in every level of healthcare. And I watch, and I'm a people watcher. I watch the people in the community, how they act. And yesterday I was working in Hazard, and Perry County got hit pretty hard with those storms. And from what I can tell, well, what Robbie Williams said in that video, or in their thing there a minute ago, I think he said like 4,000 people are without power, and some of those in Floyd County right now are without power and water. So how bad would that suck? So, so here we are preaching all this. We've got this virus out there, and we're having to stay home, and we can't just go and stay at our mom's house or at our grandma's house or whatever. And they don't have power and they don't have water, and it's cold. It's going to be cold tonight. So there, things. Tomorrow's a new day. So I pray for my neighbors in my community tonight, and I hope nobody's out there freezing. That bothers me. I can't stand thoughts of somebody being cold or somebody being hungry. But anyway, in Hazard yesterday, there was only like two gas stations I saw them talking about that they were open. So, of course, everybody needs gas. You got to have gas to get back and forth to work. But I just wonder how many of those people didn't have any business being out. And then I also saw people complaining, through the healthcare community that they couldn't even get the ambulances and the frontline providers trying to get their vehicles up there to get gas, and nobody's going to let them in. Nobody lets them cut line. Got an ambulance back here behind you, and we're all sitting in line in a very difficult time needing gas. Let the ambulance get some gas. What if your family gets sick right at that moment and they can't get to them because they don't have a full tank of gas? This is the rural area, so these guys have got to have some gas to be able to get up some of these haulers. So get out of the way of the first responders at these gas stations and stuff. Don't be selfish. Jesus is watching. Okay. Now, in the whole entire state, if you have questions, if you're sick, if you don't know what to do, anywhere in the state, because I've got comments from people through my videos and messages from all over the place. Yes, people need to quit congregating around the dollar stores like it's a new hangout place. They do. They're congregating in the parking lots in these places where they're kind of limiting people going in. So they're just hanging out, talking in the park. Just stop. Stop it. Okay. What was that? I miss my Martin County people too. I really do. Y'all have no idea. I talk about you all the time. Okay. Anywhere in the state, if you're sick, if you have questions about what's going on, what the governor's wanting, all the information that the governor throws out there, he's usually got it on this website. So we've got Kentucky COVID-19.ky.gov. This is right off of his website. This is how to seek care or when to seek care. And this is the number that you call. You can call this number and they'll route you to whatever it is that you're needing, or at least tell you the correct number of what you're looking for. So call that number if you got any questions. And Shirley, you said you applied online for your husband. One of those girls commented here, so they're watching at that. Let me find it at this. This is about the insurance. Call this, Shirley, call them. They'll find your stuff and they'll fix it. Community Connections. These girls are in Manchester. They are helping people get signed up on for Medicaid. This will get you Medicaid until the end of June. The president or the governor, Andy, doesn't want anybody without insurance right now with all this. So 606-658-2276. Call these girls and they will help you get signed up. Shirley, they will go back and they'll find your stuff and they'll see what the problem is and they'll get all that stuff fixed. Medicaid, insurance, call this number. Now, if you're local and you're sick, Floyd, Knott, Johnson, anywhere that's got an ARH, this ARH line is the number to call. If you're questioning, do I need to go in and be seen, or where do I need to go for this or that, or even if you've got something scheduled to go and see, there she is, there's Whitney, right there, that gal right there. Okay. ARH, call this number here if you have anything. If you have something scheduled, if you have testing scheduled or something, for routine whatever that you've got going on, they can tell you how you need to go about getting into the hospital because their policies are changing every day with visitors and patients and all that kind of stuff. So call ahead before you go to see what's up. 606-439-7100. You got to 11 o'clock at night to call them. This is that map that I watch all the time. This is where I get my numbers. It's the coronavirus.jhu.edu/map.html. So look at that if you want to see how this is spreading. And if you get on there and you pull up the U.S., I've got the mouse that's got the little rolly ball on it. If you scroll it to make the U.S. bigger, you can see how it started on the East Coast and it's just going toward the West Coast. Of course, there's some on the West Coast too, but just the thickness of the cases are on the East Coast, moving toward the Midwest. It's and I've been watching that for weeks. I look at it like 100 times a day, and it's just spooky. This is a number when you see people that are congregating that shouldn't be. Kentucky Safer, 833-597-2337. This is the hotline that if you see people that are not following rules, if you see this congregating going on, call Andy. Now, for our addicts in the area, if you're needing a meeting, or if you just need to talk to somebody, if you need help, then you call this number. This is our grassrootsna.org. This is our area here in Eastern Kentucky. This is RNA here. Now, you call 855-319-8869. You tell them what you need. Tell them you need help. I need help finding a meeting. They will tell you where to go. They will show you the pages to go. They will talk to you wherever you need. That's your number. Call them, get on that website. There's all kinds of information on there. All the literature and everything's on there. Now, this is something that this came up this few days, and it's really, I wish somebody had brought it up before, because I'd have been screaming from the rooftops with this one too. Domestic violence. Here we are, all of us we're home, and we're complaining about being home because we can't go out and do this and we can't go out and do that, and we're sitting around, we're eating all of our food, and we're getting fat, and with our families, and complaining about our kids and all that. And home is not always a safe place for some people. I mean, that's why the schools are still deliver meals to some of these kids, because they may not have any food there. That's not domestic violence, but that is poverty and parents that aren't paying attention. But you've got domestic violence. There are men and women that are in homes. There's children that are in homes right now where domestic violence is a big deal, and it's going on, and it's scary, and it is real. And if you've never lived through it, then you're not going to get it. You just don't judge. Just don't judge people that are having to live through this. But just know, if you can hear me, you can get on Facebook. These people will give you a voice. They will help you. This is the hotline, 1-800-649-6605. Home is not a safe place for everyone, and that is a terrible thing to think, especially right now when everybody's in quarantine and they're saying you got to stay home and do all this. I'm sure there's a lot of people out there that are alone, and especially with the case that's come up this week. It's been a hard hit for us around here. It's just a terrible, terrible thing. Anyway, here is the website for that. And I had to hunt down Kelly's Facebook page so I could get all this and make sure that I was right. But it's turningpointky.org. This is the website. They have a Facebook page, and that is the number. If you're home and you're scared, if somebody's there hurting you, if you do not feel safe, call this number or call your sheriff's department. They're going to be all over this right now. Also, the other thing that I've not really seen anybody else address, we have an increase in suicides. So 1-800-273-8255 or suicidepreventionlifeline.org. If you are having thoughts of hurting yourself, if you're in that domestic violence relationship and you're thinking about hurting yourself, if you're any reason, if you can't get your medicines, it doesn't matter. It doesn't matter. If you feel like you're going to hurt yourself, call these people, reach out to a friend. There is people out there waiting to help you. So, what is everybody obsessing over today? What is everybody freaking out over today? Okay, we've addressed the gloves. Yeah, don't wear gloves in stores. They're gross. You're spreading the cooties with the gloves because you think you have this false sense of security when you have gloves on. When I went to nursing school, way back in the day, we had to actually go through checkoffs on how to put gloves on and off. And our instructors watched us and made us very aware of when we were contaminating our gloves, especially in sterile fields. You all have never been eat up by a surgeon getting ready to do surgery and you've messed up your sterile field. You just obviously not. But if you've not been trained to be aware of that, now there's some OCD people that probably do pretty good with this, but you're going to contaminate everything. You're going to be touching your groceries and pushing your cart and swiping your hair and touching your face and picking up the can of SpaghettiOs and putting them in there, and then I've got my gloves on so I'm safe, so I'm wiping it through my hair, and then you go on to the next. Just don't. Just wash your hands. If you skin to product, you will be more aware of where your hands are than if you've got gloves on. So just keep your hand sanitizer and wash your hands whenever you can. After you've loaded your groceries in, use your hand sanitizer. Clean off your groceries when you get them home. Pull your shoes off at the door before you go in the house. So, because now there's all these articles coming out saying, oh, look, the gross stuff can live on the bottom of your shoes. Go back to my first video, see if I didn't say that. Okay. I'm about out of Lysol. Yeah, I know. Everybody's about out of Lysol. You can't find it. If you are looking for a family practice provider right now or any type of anything, most of these doctors have got some sort of telehealth going on, which is probably what I'm going to end up doing with my private practice before we actually can get the doors opened. So, but I'm not there yet. But call that ARH number. What do I do with it? Right here. Call this ARH number. They will put you in touch with somebody that is accepting patients and that can help you, especially if your need feels on medications and all that kind of stuff. Then do that. Any word on when elective procedures? No, I have not heard when that's going on. And they're trying to figure out now how they're going to start reopening the country. And but that I'm pretty sure they're not ready for that just yet, because if we just open the doors back up and let everybody loose, we're going to have that whole Philadelphia spike thing that the governor pulls up every day. Going to be happening. So we have to be real careful how we do all this. So I don't know when electives are going to happen. But if the elective that you're talking about there, Sean, is what I'm thinking that you're talking about, then I don't know that would be elective. So I don't know. Message me about that later. We'll talk about that later. Questions, comments, concerns. Be nice. Oh, I see. Okay. We may have to go somewhere else for all that. Okay. Knee replacements, that's probably going to be considered an elective for right now. So just hang tight with that. The other case is a little bit different. I know Ramonica's on there. Have I missed anything? Have I quarreled and complained about enough? 200 tests a day is going to make a big difference. So y'all prepare yourself. Tomorrow, I'm sure that there's going to be more. What is tomorrow? Wednesday. I think Les is going to be talking tomorrow. I think he's switched to like Monday, Wednesday, Friday. So he may tell us more, but the health department will get on there and they'll keep us informed. They've done real good about all that. Can it be caught from hot food such as takeout? Now, from what I can tell, they're not saying that it's in your food, but you got to think that the stuff that it's contained in. I mean, we bring our groceries home and we're supposed to clean our grocery containers off. Get rid of your plastic bags. They're saying that it live on cardboard for a while, so you got to think about your pizza boxes and stuff like that. So I'm not going to say that eating out is a bad idea, but I can't really say that it's a good idea either. But we have to support our community. And I'm pretty sure that they are hosing everything down that they possibly can with Lysol and Clorox and bleach and all this kind of stuff, because the food industry has to have these cleaning supplies and stuff like that. So, they're not letting anybody in, so they're not having to use their cleaning supplies in their out where their tables and stuff are. So, if you look, they are wearing their gloves. You can always see the hand sanitizer sitting in there and stuff. So, and I'm sure that there's people watching them. Where I'm diabetic. Listen, this dude today, 22 years old, young. So, he didn't have anything, any comorbidities. So, yeah, if you're diabetic, you're at high risk. If you're high blood pressure, you're at high risk. If you have heart disease, you're at high risk. If you're lung anything, you're going to be at high risk. But this was a 22-year-old guy with no comorbidities that come up positive. So we know they ain't none of us safe from this. We'll probably do okay if we get it, because there's a very small percentage of people that are dying from this. But so for the most part, we'll get it and we'll be fine. But we need to try not to get it. Drink plenty of water, take your vitamins, eat healthy, don't eat junk. That's late in Tyler's age. Yeah, I know that's exactly what I was thinking. That's 22. I've got a kid older than that. So just common sense. Just use your common sense. I mean, this is just like, what would you do? What are you going to do to not catch the crud, the cooties, whatever you want to call this? That's what you need to do. Anything that you think you can bring this in your house with, be very, very aware of where your hands are, where your shoes are, what you've touched. Clean off your groceries, clean off your mail. Do something with your mail. I know a lot of people are spraying their mail with Lysol before they bring it in and stuff like that. So, but yeah, it's in the mail system. There's UPS, the postal workers that are getting this. There's Amazon workers that are getting this. Hell, the whole Tyson chicken factory, had to shut down in one area because there was a bunch of them got it. But it doesn't have anything to do with anything other than they picked it up somewhere and one person got sick and spread it to other people. There's people walking around right now that has this and have zero symptoms and won't for about a week. And then those 200 tests a day, they're going to start swabbing them and they'll come back and they're going to be positive then, But there are literally people walking right now that have this and have no symptoms. And they may never have symptoms. And then they may get sicker than hell. We don't know. We don't know how any of us is going to react to that. But clean your house, clean your shoes, clean your hands. Hang out with your family that lives in your house. Don't be inviting people over that don't live there because you don't know where they've been. Just think of everybody as being dirty. Everybody's dirty. Everybody could have this. Everybody has been exposed to this. So now you got to figure out who's going to get sick and who's going to pack it into you and your children. Children, 22-year-old kid and a 21-month-old baby, positive today. So, yeah, it can be packed into your kids. So, until next time, microwave mail, do not microwave your mail, Brand. I wish it was that easy. It'd be one of those mails that you've won something. It's got one of those metallic looking shiny stickers in it, and then you've got a fire. So no, don't microwave your mail. Just spray it off with the Lysol and let it sit for a while if you can. All right, I'm out. So until next time, until we've got more stuff to talk about, just don't panic. Just don't panic. And remember what you're supposed to be doing. In order to protect yourself and your family, shop for your neighbors, protect your community. So shop for your neighbors. One person per cart in the stores. Don't take your kids in the stores if you absolutely don't have to. I know Les said something about, there is an exception if you don't have anybody to keep your kids or whatever. And I know that does happen. But if there is any way you can not take your kids in the cart or into the stores, then don't. Wear masks when you're out in public. Social distance, 6 feet. If somebody's coming to you to talk, back off. Put your hands up. Say, whoa, back off. What do you think I do? I tell them all the time, get social distance. I'll holler across the aisle at people. Hand washing. Use hand sanitizer. Lose the gloves. Don't hang out with anyone that don't live with you. No social or mass gatherings at all. Take your shoes off at the door of your house. Cover your coughs. They talk about coughing into your sleeve and into your elbow and all that kind of stuff, and that's fine if you don't have anything else. But if you can have a tissue, then you cover your mouth when you cough and then throw that tissue away. Don't stick it back in your pocket, because then you could just be putting the cooties back in your pocket. So let's just throw it away. Where can you get the mask at? If you put out a shout out on Facebook, then there's people making masks all over the place. You can use a bandana. You can use anything to cover your mouth and nose, just anything to protect yourself and the people around you. What about people acting like healthcare workers are ate up with it when going in stores? Yeah. I don't mind people not coming around me and acting like that, but they best not say nothing to me. But yeah, be nice to the healthcare workers. There's people that has to go. We all have to go into the stores, but if you see somebody in scrubs in the store, don't act like they're horrible people. I mean, they're saying, all kinds of people are saying terrible stuff to healthcare workers that are in these stores. They have to shop too. And as long as you're 6 feet away from them, get away from them. Just stay away from them. And you're going to be fine. They're not putting anything out there that's not already there. And those people might be the ones that's saving your life on down the road. So just be cool with all this. We all got to get through this. Well, just like Andy says, we'll get through this together, but you got to use your heads, use your common sense, and everybody just be cool about all this. Help your neighbors. Don't go to my parents' house. That's a big thing. Big deal. My sister's sitting across the road because she can't go anywhere either, and she's watching. So, peace out. Until next time.